My name is Jody Little, and I'm the adult honoree for this year's Bone Bash.
My name is Brent Damer. I'm the medical honoree.
I'm Sarah Perryman. I am the rheumatology medical honoree. My arthritis story is I have a history of Crohn's disease and more recently started suffering from lower back pain related to Crohn's disease, and that has been a challenge for me, but the treatments have been wonderful, and as a rheumatologist I kind of have a deeper understanding about what my patients are dealing with on a day-to-day basis, so it's just made me a more compassionate physician.
So my arthritis story starts with my uncle who has rheumatoid arthritis, and seeing him deal with that day in, day out. He was a semi-professional golfer, and having to give up his dream of pursuing that kind of hit home with me. As I started going through medical school, though, I had a chance to be able to see a total joint knee replacement performed. And then as I started working with that more and seeing how patients can restore their lives and get them back to doing their activities and going to see their grandkids' activities or their own personal activities, really restoring their life, that really hit home with me. I wanted to do more of that and work with that more.
So I was diagnosed with rheumatoid arthritis about 20 years ago. Symptoms started where I had pain in my feet and ankles. So after a slew of blood tests, I was diagnosed probably about 2 or 3 months later.
What do I wish people knew about arthritis? I wish people knew that there were more options available, not just surgical. Obviously I'm a surgeon, there's options there, but yet there are non-surgical options. There are ways to help with maintaining your livelihood, your activity level, sometimes physical therapy. There are some medicines that can help, sometimes just weight loss. There's different modalities that we can do to help try to maintain that healthy lifestyle and activity level.
I wish people knew that arthritis can affect even young people. It's not just an old person's disease. There's over 100 different types of arthritis. And just also to people living with arthritis, such as myself, we might look like we're fine, but most often we're not. So there's a lot of fatigue, a lot of chronic pain, weight fluctuation due to different medications. So I just would encourage people, if you know somebody is dealing with arthritis, to give them some grace.
I wish people knew that arthritis does not mean that you are going to be debilitated, that there are really great treatments out, that there's ongoing research for inflammatory arthritis and other forms of arthritis, that this does not mean that it's the end, that it's the beginning. The Arthritis Foundation invests in many things. Research is one portion of that, which is a big area, but also advocacy is a big area as well. Creating more awareness in the community.
They do different annual events such as the Bone Bash they do every year. They do the Jingle Bell Run. They also provide different camps for children. There's research that's ongoing to help find a cure, because there's currently not a cure for arthritis. So there's many different avenues that they can take to help people living with arthritis.
Drew me to get involved and fundraise for the Arthritis Foundation was the company I work with, Central Indiana Orthopedics, wanted to be a sponsor and help provide funding with the Arthritis Foundation. With that, we had patients vote for who would be the medical honoree from our group, and that happened to be me.
My name is Jim Garringer. I live in Muncie, Indiana. I was a runner for many years. I did a number of marathons. I've done the mini marathon, I don't know, maybe 30, 35 times, during my days of running. I still walk the mini marathon. It takes a little bit longer, but I enjoy doing those things. And several years ago, I had begun to notice an increasing amount of pain in my left hip. I wound up being referred to Dr. Damer. And when I met Dr. Damer, I was quite impressed with him from his breadth of knowledge, his cordiality, his expertise, and he did some x-rays, and it was determined that I had an arthritic left hip. And in fact, he said, you not only have an arthritic left hip, you have an arthritic right hip, but your left hip is arthritic, and you need to seek help for that. In 2016, I had my left hip replaced. 3 years ago in 2021, I had my left knee replaced. Last year in 2023, I had my right knee replaced. And then about 6 months ago in 2024, I had my right hip replaced. Dr. Damer did every one of my surgeries. I was quite satisfied. A caring man, professional, thoughtful. He's got a sense of humor. And I just can't think of anyone I would rather have that relationship with. I wish I had 2 more hips and 2 more knees for him to work on. Well, maybe not.
As I grew more and more involved with it, learned more and more about the Arthritis Foundation and what they're involved with and what they do, that spurred me on to looking at opportunities to help gain sponsorships for the Arthritis Foundation and find funding to help with that.
I've seen the great things that the Arthritis Foundation does, and I've been involved in the Arthritis Foundation for approximately 3 years now, and I wanted to be more involved more recently. I just opened my own practice and wanted to give back to the community somehow, and I thought this was a really great way was to start fundraising and really get more involved with the Arthritis Foundation.
Well, the Arthritis Foundation, I got connected with them just to use my story to help inspire and encourage other people living with arthritis. Also want to help people know that there's resources available to help them, whether that be finding support groups or even finding a physician, even medication information. So they offer a lot of information to the community.
In order to help keep people active and keep people moving, we need resources, we need research, we need activities and advocacies there, and that's what the Arthritis Foundation provides.
If children get diagnosed with an autoimmune disease, an inflammatory disease, the Arthritis Foundation is there.
Arthritis is the #1 debilitator in America, and that's something else I wish patients knew. It is a true debilitator, keeping you from doing things.
So the Arthritis Foundation is a big part of helping these patients.
The donations are critical to keep the foundation going.
And so in order for the Arthritis Foundation to do that, they need funding, they need sponsorships, and so I think that's a great cause, it's a great organization to get behind and help support.